Aloha everyone, today we're talking about blocked tear ducts, and blocked tear ducts happen in adults and kids, but we're going to talk about babies today because I'm a pediatric ophthalmologist and that's what I do. So a blocked tear duct, what is it? That is when you bring your newborn baby home and you notice that their eyes are tearing, they are swollen shut, there's so much gunk in the eyes and it's constantly running tears down their face. That is a blocked tear duct. And all it is an extra little piece of membrane, a little tissue that just didn't open up when the babies were born. Happens in about 5% of newborns, so it's super common. Actually, all 3 of my kids had it. And in itself, it is not worrisome. It doesn't cause any vision damage. But the thing is, you want to make sure that that's actually what it is. There are a lot of things that can cause tearing, redness, discharge, which are serious. So you always want to get your baby checked out by a pediatric ophthalmologist or your pediatrician to make sure that there's not anything more serious going on. But let's say your pediatrician or your pediatric ophthalmologist did diagnose your baby with a blocked tear duct. Now what? First, how do you clean it? Eyes are swollen shut. You want to just be as gentle as possible, of course, with newborn skin. So just some cotton tips, some little, you can use little Q-tips, little cotton balls, wet it with warm water, and just really gently clean the eyelids open. A little washcloth is fine too. Then the most important thing that you can do is something called Crigler massage. And what Crigler massage is it's a way of increasing the pressure in the nasolacrimal system. Where your tears drain in this inner corner, there's a little hole in the top and bottom called the puncta. And they go down into your nose, and that's where your tears drain. So that's why you get a runny nose when you cry. So in these babies, they've got that little, like a blocked tear duct is all it is like a clogged drain. So the tears are overflowing like a clogged drain through the front. So we want to open up that passageway, and the massage, by actually doing it properly, creates this pressure that kind of sucks everything in and helps open the passageway up. So you want to do it 3 times a day, 5 times each time. So what you're doing is you're going to push right in the inner corner of the nose, that bony prominence, and then you're going to roll your finger down all the way towards your nose. Now, unfortunately, I've seen a lot of videos and a lot of blog posts demonstrating the technique of massage for blocked tear ducts, and it's incorrect. You're not like rolling your finger all around here. That's not what we're doing. We are actually just really simply applying pressure and then rolling your finger down. It's not like a massaging motion of the actual hole right there. That's not it. So you want to do that 5 times, 3 times a day. The other thing, your pediatrician or your pediatric ophthalmologist might recommend an antibiotic ointment if there's a lot of gunk and there's a lot of crusting and the baby just can't even open their eyes. Breast milk has also been shown to be effective. There's a lot of great immunoglobulins. I actually did that for my kids and I found it even more effective than using the antibiotic ointment, truth be told. So these are the techniques you want to do for how to actually perform blocked tear duct effectively. Crigler massage, how to perform Crigler massage effectively to improve your baby's symptoms. 95% of the time, these blocked tear ducts resolve spontaneously by themselves with this massage. If you do the massage, it really will help. 5% of the time, we actually have to take a baby to surgery and insert these tiny little metal tubes through the hole all the way down into the nose to puncture the membrane open. But if you do the massage, most of the time it is going to help. So it's really important you know the proper technique. So if you like this video, please comment below. If you have any questions, I'm happy to answer. Please let me know if there are other topics that you want addressed. I'd love to hear from you guys, and like the channel.